So today we're going to be working with the jaw. Now we could press into the masseter muscle, we could try to look for trigger points, we could, in my opinion, cause a little more inflammation there by poking around too much. But there's another way of coming at it. It's kind of indirectly, and by working indirectly, by working with the myofascia in mind, we're going to not just be working with the masseter, but also with the temporalis and with the pterygoids, everything that's connected to this complex, this jaw complex. We're also going to be addressing the sternocleidomastoid. The SCM also inserts right next to the TMJ. If this attachment site is inflamed, then there's no reason that inflammation won't carry over to the jaw and vice versa. So we're going to be working with all of these. We're going to be thinking locally and working globally. All right, so with Jessica here, I'm going to do a little bit of warm-up, and I'm going to be doing myofascial release. So I don't have any oil, any lotion on my hands. I'm going to be using the oil that already exists on the skin, and I'm going to be moving very slowly, so this video might be a little boring, so I'm going to gab the entire time. So what I've done is I've sunk in, I've engaged the tissue right near the jawline, so at the very bottom of the mandible, and I'm following the course of the masseter muscle. I'm probably moving a millimeter every few seconds. This is not a fast technique. And so while I am concerned with the muscles involved, for instance, masseter, I definitely want to reduce its tone. Temporalis, I'd like to reduce its tone. I'm going to move over this zygomatic arch here, this cheekbone, and not let up my pressure. I'm worried about the planes of fascia rather than the muscles themselves. So now I'm getting up into temporalis, the belly of it. My pressure is directed toward the top of her head. It's not directed inward. If it were directed inward, I could be causing her some pain in her temples right now, but it's not. I'm dragging the tissue. And Jessica, go ahead and take some easy deep breaths. And whenever I ask a client to take those easy deep breaths, I do the same. It helps for later in the massage so that we are acting in sync. And you'll notice how slow this technique is. But if Jessica, and I'm not asking you to do this, if Jessica were to open her jaw right now, she would feel this in her jaw. Even though this isn't close at all to that temporomandibular joint, it's still deeply connected. So when I'm working with a client on the table, I'll usually do 2 passes of this. The second pass, I will have some client engagement. So as I'm going up, I'll say, now go ahead and open and close your jaw by about 3 millimeters, very slowly and very gently. If they start going too fast, I will have them slow down. And I'll have them continue that the entire way up. That extra client engagement can make this a more effective technique, in my experience. Now you can continue this all the way up into the hairline because the fascia continues on. But I'm going to stop about right here. And at this point I'll usually have the client reevaluate the tension in their jaw. So just go ahead and open and close your jaw a couple times. Does that feel a bit looser?
Mm-hmm.
Okay. And people with TMJ problems, just getting a little bit of extra freedom in their jaw can be incredible. So with the sternocleidomastoid, some of you might be afraid of working with SCM, and that's understandable. We've got a lot of neurovascular stuff right by that, but if you feel a pulse, move away. It's that easy. But working with SCM, just realized that it's got two heads and that we want to address both of them, and that you can lift it from the underlying structures. So if you're working with SCM on a surface level and you're not encountering both of its head, if you're not mobilizing it, consider that there's more that you can do with the SCM. SCM is a very active muscle. We use it all day, every day, so anything that we can do to bring awareness to it, and anything that we can do to bring freedom to it, is going to be helpful. So, I know that this is lengthening the SCM, but I'm actually going to turn Jess's head a little toward the camera. So now this left SCM is a little longer, but it also puts it into a better position to be lifted. So now I've got the entire belly of the muscle between my finger and thumb. And Jess, is that uncomfortable? Okay, this doesn't have to be unpleasant. And this is actually the treatment. I have engaged it, and I have lifted it, and just that much awareness can be enough to create some freedom, to create a lessening of tone up in that attachment site. Let me show you how I did that once again. I took this part of my knuckle, I went up, I went anteriorly, and then I pinched with my thumb. So here's how that looks. Again, I'm not using lubrication here. And you'll notice how this lifts it away from the rest of the anterior and lateral neck. So I'm going to reach all the way around front. If I feel a pulse, I'm going to move away, but I don't. And right now I'm on the sternal head. And if I allow myself to bump over that sternal head, I'm on the clavicular head. And I'm just getting a little bit of attention. I'm not pressing in, I'm not working with trigger points. I'm just engaging the tissue and bringing the client's awareness to it. And you can do a little bit of work closer to this attachment site. Right now I'm doing the same thing as I was doing with the jaw. I'm engaging the tissue and I'm dragging northward. Okay, so give this a try. I've had a lot of success with this with my clients who have TMJ. I've also got a way of doing that the clients can do this for self-care. I'm going to supply a link to that at the bottom. And give me some feedback. Let me know how this works. Again, I'm Ian Harvey with Fortis. Have a great day.